Hello, so we are Group 1 and we're going to discuss Republic Act number 9994. It is an act granting additional benefits and privileges to senior citizens, further amending Republic Act number 7432. As amended otherwise known as an act to maximize the contribution of senior citizens to nation building, grant benefits and special privileges, and for other purposes. So this act was enacted by the Senate and House of Representatives of the Philippine Congress. It is also known as the Expanded Senior Citizens Act of 2010. Expanded meaning there are already existing acts that has been made, and it is further amended due to the current situation and problems or needs of the country. So what are these acts? The first act is the Republic Act number 7432. It was amended by it is also known as the Senior Citizens Act of 1991. It was amended by Republic Act number 257, otherwise known as the Expanded Senior Citizens Act of 2003. Then ngayon, it was further amended. It was held in Metro Manila, Monday, July 27 of 2009. So what are the declaration of policies and objectives? So the state must, the policy of the state to promote a just and dynamic social order para ma-ensure na merong prosperity and independence yung ating nation. Then, free the people from poverty through the policies that provided adequate social services. Through the policies and through the policies made, dapat yung mga tao ay makalaya na sa kahirapan. Then, promote full employment sa ating mga senior citizens para magkaroon sila ng rise of standard living and therefore have an improved quality of life. So, ito, under din siya ng Declaration of Principles and State Policies. Pero, further, pa siya study? So, the state shall provide social justice in all phases of the national development. States, dapat vina-value nila yung dignity ng every human person at full respect sa human rights ng mga tao. Then, state shall also adopt an integrate and comprehensive approach. Dapat maka-adopt sila ng mga approach na to para yung mga essential goods, health, and other social services maging available sa lahat ng tao sa affordable cost. Dapat din maging priority yung mga underprivileged, sick, elderly, disabled, women, and children. So, it is the duty of the family to take care of the elderly members. Yung mga family, sila yung may duty na mag-alaga sa mga elderly members nila. Habang yung state naman, sila yung gumagawa ng programs para makagawa ng social security sa mga elderly na ito. Consistent with these constitutional principles, this act shall serve the following objectives: to recognize the rights of senior citizens to take their proper place in the society and make it a concern of the family, community, and government; to give fully support to the improvement of the total well-being of the elderly and their full participation in the society, considering that senior citizens are integral part of the Philippine society. So, to motivate and encourage the senior citizen to contribute to nation building, to encourage their families and communities they live with, to reaffirm the valued Filipino tradition of caring for the senior citizen, to provide a comprehensive healthcare and rehabilitation system for the disabled senior citizen, to foster their capacity to attain more meaningful and productive aging, to recognize the important roles of private sectors in the improvement of the welfare of senior citizens, and to actively seek their partnership.
Section 3. In conformity with these objectives, these rules shall: Letter A. establish mechanism whereby the contribution of the senior citizens are maximized. Letter B, adopt measures whereby our senior citizens are assisted and appreciated by the community as a whole. So, yun nga, kagaya sa mga pagpila natin, merong mga priority lane for senior citizen para hindi na sila pumila ng mahaba. And yung mga discount nila for their medicines. And letter C, establish programs beneficial to the senior citizens, their families, and the rest of the community that they serve. So, yung mga example nito is Community Welfare Program, Family Welfare Program, Child and Youth Welfare Program, Person with Disability and Senior Citizen Welfare Program, and Emergency Welfare Program.
Rule for privileges for the senior citizens. OSCA issued senior citizens identification card. This identification card is a proof of senior citizens and para makabili sila ng necessities nila with an affordable price. 20% discount and VAT exemption. This will help the seniors na makaka-discount at hindi magkaroon ng value-added tax sa mga goods and services na gusto nila. Medical-related privileges, medicine and drug purchases, 20% discount and VAT exemption ay magagamit ng seniors sa pagbili ng generic and brand names, vaccines, and also pwede nila ito magamit sa pagbili ng vitamins and other supplements nila. Essential medical supplies, accessories, and equipment, usually sa matatanda is malalabang mata and very prone sila sa bone weakness, kaya magagamit nila dito yun. Medical and dental services in the private facilities can be used sa papatingin nila and pagla-laboratory test na ni-request ni Doc para sa sakit nila, ma-apply dito ang discount and VAT exemption. Professional fees of attending physicians. In all private hospital, medical facilities, outpatient clinics, and home healthcare facilities shall be subjected to the 30% discount and VAT exemption. Professional fees of licensed health workers providing home healthcare services as endorsed by private hospitals or employed through home healthcare employment agencies are entitled to the 20% discount and VAT exemption. Domestic transportation privileges, air and sea transportation privileges. Dito yung gumagamit ng aeroplano, barko at yung pagka-transpeaking. Public land transportation privileges, yung mga jeep, LRT, MRT, bus, AUV, and taxi. Mayroon discount and VAT exemption. Hotels, restaurants, recreation centers, and places, leisures, and funeral services. Hotel and similar lodging establishments for room accommodation and other amenities offered by the establishment, restaurant. May apply dito sa drive-thru, take-out, basta yung senior mismo yung bibili. Kapag sa delivery naman, basta nasabi yung card details and ipapakita yung card sa delivery man. Recreation centers, kapag non-profit and private member ka na isang golf and country clubs, hindi ka nakasali sa may 20% discount. Admission fees privileges, discount shall be applied to admission fees charged by the theaters, cinema house, and concert hall services and carnivals. Funeral and burial services, dito kasama na din yung magpapakabaong ka or earn embalsamo, morgan hospital at paglipat ng katawan sa libingan. Credit card payments apply to purchases of goods and services by senior citizens paying through credit cards. No double discounts. Kung sakali PWD ang senior, maaari niyang gamitin yung OSCA-issued ID card or yung PWD ID card para makakuha yung 20% discount. Tax deduction. The establishment may claim the discounts provided herein as tax deductions based on the cost of goods sold or services rendered. Other privileges, income tax exemption kapag siya ay maliit ang kinikita. Exemption from training fees. Senior citizens shall be exempted from training fees for socio-economic programs conducted by private and government agencies. Free medical and dental services in government facilities, medical and dental services, diagnostic and laboratory tests, medical facilities, outpatient clinics, and home healthcare services shall be provided free of charge to senior citizens. Free vaccination for indigent senior citizens. Administer free vaccinations against the influenza virus and pneumococcal disease for indigent senior citizens patients. Educational privileges and occasional assistance shall be granted to senior citizens to pursue post-secondary, post-tertiary, as well as vocational or technical education in both public and private schools. Benefits and privileges for retirees. Retirement benefits mula government o private sector ay needed to review regularly, annually, para masiguro ang patuloy na pagbibigay ng benefits sa mga retirees. Privileges on granting special discounts in special programs. The government may grant special discount in special programs for senior citizens on purchase of basic necessities and prime commodities. Express lanes, privileges, accessible express lanes for senior citizens shall be provided in all private, banking, commercial, and government establishments. Utility discounts. 5% discount. Para makuha ng seniors ang discount, kailangan na yung senior mismo ang mag-apply ng discount or yung representative ng senior. And kailangan din na annual na renewal na application. At sa pagsabit ng requirements, needed yung proof ng age and citizenship, proof ng billing. Dito, kinakailangan na pangalan sa senior yung metro and proof ng residence. 50% discount, grant of a 50% discount on all electricity, water, telephone consumption for the SWD accredited senior citizen centers and residential care institutions. Requirements to avail the benefits of a senior citizen. First, an identification card issued by the Office of the Senior Citizen Affairs kung saan naninirahan ngayon yung senior. Second, the passport of the senior citizen concerned. And third, yung mga ibang document na nagpapatunay na yung senior citizen ay isang residente dito sa Pilipinas and at least 60 years of age dapat.
Next topic is the government assistance. First is the employment of senior citizens. Dito, ang elderly population sa ating bansa ay mabibigyan ulit ng employment opportunities to be productive even in their old age. Kasi one of the major problem na kinakaharap nila ay financial security kasi most of them wala ng trabaho at yung iba nakadepende na lang sa sustento ng kanilang mga anak. Kaya yung government nag-provide pa din ng employment assistance sa mga senior have the capacity na magtrabaho or be re-employed again. Kapag ang isang SSS pensioner naman na below 65 years old ay nagkatrabaho ulit, ibig sabihin nun ay may hinto na din yung pension niya. Next is education. Sa tulong ng DepEd, CHED, TESDA, in consultation with the NGOs, nag-establish sila ng mga program para ma-ensure yung mga senior citizen natin to formal and non-formal education. Next is health. Dito, yung DOH, nag-establish sila ng mga senior citizens ward in every government hospital. Ito, exclusive lang siya sa mga senior citizen natin, pero pag may emergency, pwede naman siyang gamitin ng iba. Next is social services. Local government units shall ensure that the developed programs and social services are provided. Ito yung at least 50% discount sa consumption ng kuryente, tubig at telephone by the Senior Citizen Center for the purpose of promoting the well-being ng mga senior citizen natin na inabandona, pinabayaan, or yung mga wala na talagang matiran. Next is housing. So, yung national government, nag-include na din sila ng National Shelter Program, the special housing needs of senior citizens such as establishment of housing units for the elderly. Next is government assistance that will directly benefit senior citizens. First is monthly social pension of 500 pesos to be given to indigent senior citizens. Ito naman, for the daily subsistence and medical needs, reduce incidence of hunger and protect them from neglect, abuse, deprivation, and natural and man-made disasters. Next is death benefit assistance of 2,000 to be given to the nearest surviving relative who cared for the deceased senior citizen until his or her death. Ito, matutulungan sila sa mga gastusin like nung sa casket or urn, pag-embalsamo, cremation, and other services such as wake or viewing costs. Pero hindi kasama dito yung memorial lot. Next is mandatory PhilHealth coverage. Ito, walang pinipili kahit mahirap o mayaman basta 60 years old ka. And yung fund na ginagamit dito ay tinatawag na syntax fund. Kaya naipatupad ito dahil nagiging malaking problema sa bawat pamilya na may nakatatanda na walang napagkukunan kapag may dumadating na pagkakataon na nagkakasakit sila. When they are confined in private hospitals, they can avail of PhilHealth benefits in addition to the 20% discount and VAT exemption. In government hospitals naman, the no balance billing policy ang na-apply.
The Office for Senior Citizens Affairs are established in every cities and municipalities to serve as an office in terms of catering the concerns of senior citizens. The OSCA must have a head or a leader or representative, and he should be a Filipino citizen and resident of the municipality or city for at least a year. And of course, dapat registered voter siya ng city or municipality na kinakasakupan niya. And of course, dapat literate siya wherein he is able to read and write, must be physically and mentally capable of performing the task of OSCA head. A bona fide member of a duly registered senior citizens organization of good moral character and at least a high school graduate. So, in the selection and terms of office of the OSCA head, so si mayor, si city or municipality mayor ang mag-a-appoint ng OSCA head from a list of 3 nominees na ibibigay ni DSWD or any senior citizens organizations, or pwede rin naman na through General Assembly mag-appoint sila ng kanilang OSCA head. And then that appointed OSCA head has a term of 3 years without reappointment. So maximum of 3 years lang ang kanyang terms of service. The head of OSCA shall serve the interest of senior citizens, and maaari lang siyang ma-eject sa kanyang position or mapalitan in terms of sudden death, permanent disability, and ineffective performance of his duty. So, the new appointee would serve the remaining term of the previous head of OSCA. So, ang benefits, meron siyang honorarium equivalent to salary grade 10, and of course, he is assisted by the city or municipal social welfare and development officer. Diba kasi ang senior citizens ay covered siya ng DSWD, and meron nga tayong mga programs for senior citizens na ini-implement si Mayora, ganyan. And si DSWD yung nagko-coordinate nun. So, the functions of OSCA, I will just summarize it. So, ayun nga, in consultation with the city or municipal social work and development center. So, sila yung nagpaplano or yung nagde-develop ng mga ideas, or sila din yung nagpo-formulate ng mga special work labors para sa ating senior citizens, especially yung mga indigenous people. Yung municipality or yung city, nagbibigay sila ng work program sa kanila. Most commonly through community services, like lang yung pag kunyari sa canteen ng municipality, ganyan, i-hire sila doon para kahit papano merong income si senior citizen. So, trabaho rin ng OSCA na i-maintain and regularly update yung list ng senior citizens so that mabigyan ng senior citizens identification card and purchase booklets. So, nagsiserve as liaison center of the needs of senior citizen yung OSCA. Kumbaga, siya yung middle channel between the Office of the Mayor and the senior citizens. So, sabi ko nga kanina, nagbibigay ng purchase booklets and identification cards yung OSCA. So, function rin ng OSCA to monitor kung sakaling yung mga establishments ba is sumusunod sa Expanded Senior Citizens Act, kumbaga, nasusunod ba, na ibibigay ba yung tamang discounts na privilege ng ating senior citizens. And kung sakaling hindi nasunod yun, si OSCA, trabaho niya na i-report yun sa mayor or i-assist yung ating senior citizens to file complaints against sa mga establishments na hindi sumusunod sa law, so that mabigyan pansin yung rights ng ating senior citizens. Kumbaga, ang OSCA, it serves as a legal representative for the senior citizens.
Penalties and other sanction. Article 22, violations in discounted medicine purchases. Section 1, sinasabi lang na yung person misusing the privilege by using several purchases booklets. Nag-avail sila ng discount to buy medicines, drugs, medical accessories na hindi naman pala para sa senior citizen. Unauthorized use of the identification card of the senior citizen. Parang sinasabi sa Section 1 is ginagamit nila yung discount or inaabusin nila yung discount na nakukuha ng isang senior citizen. Section 2, a medical practitioner giving prescription to the other person in the name of senior citizens or giving anomalous prescription. Section 3, retailers and establishment dispensing medicine. Refusing to grant a full 20% senior citizens discount and VAT exemption of drugs medicine purchases paid via credit card. Parang sinabi dito is tinanggal nila yung 20% discount and yung VAT na makukuha ng senior citizens kasi nagbayad sila via credit card. And sinasabi rin dito na magkaiba daw yung discount na makukuha dun sa branded and generic drugs. Tapos bawal din na sabihin mo dun sa customer na limited lang yung paggamit ng discount na makukuha ng senior citizen. Article 23, violations in discounted food purchases. Sinasabi lang sa Article 23 na inalis nila yung 20% discount and VAT exemption on take-out, take-home, drive-thru orders ng isang senior citizens and also yung sa deliver order. Article 24, penalties. Any person who violates any provision of Act and its rules shall suffer the following penalties. First violation is not less than 50,000 but not exceeding 100,000 and imprisonment not less than 2 years but not more than 6 years. Subsequent violation not less than 100,000 but not exceeding 200,000 and imprisonment not less than 2 years but not more than 6 years. A person who abused the privilege granted herein shall be punished with a fine of not less than 50,000 but not more than 100,000 and imprisonment of not less than 6 months. If foreigner naman yung nagkaroon ng penalties, madedeport sila immediately. And pag naman corporation, partnership, organization is may involve yung president, general manager, managing partner, or such other officer dun sa liability. And last, upon feeling on appropriate compliance and after due notice and hearing, the proper authorized may also cause the cancellation and revocation of business permit to operate, franchise, and other similar privileges granted to any person, establishment, or business entities that fails to abide by the provisions of the Act and these rules.
Monitoring and coordinating mechanism. So, Section 1, meron tayo dito yung NCME composition. So, a National Coordinating and Monitoring Board shall be established which shall be composed of the following. So, ito nga yung chairperson. So, dito sa chairperson, ito yung secretary of the DSWD or an authorized representative. And then, for vice chairperson, ito naman yung secretary of Department of the Interior and Local Government or yung DILG o kaya an authorized representative. And then for the members, ito yung mga secretaries or authorized representatives of the following. So ito yung Department of Justice, Department of Health, Department of Trade and Industry, and representatives from 5 accredited NGOs for senior citizen. So dito sa representatives nito, they are duly accredited by the SWD and have service primarily for senior citizens. So, in Section 2, meron tayong NGO or PO representation. So, these NGO representatives shall be served for a period of 3 years. So, meron tayong criteria for selection dito sa mga representatives na to. Una is dapat NGO is duly licensed or accredited by the SWD, and isa pa, dapat they shall be senior citizen or from other sectors that have services primarily for senior citizens. Section 3, level of representation. So, dito naman sa level of representation, dapat yung authorized representative from government agencies. So, dapat may rank siya na hindi bababa sa director level or its equivalent. And then, for the NGOs naman, dapat yung rank nila hindi bababa sa Executive Director. And then, next one is yung Section 4 for the function. So, dito nakalagay yung mga functions ng National Coordinating and Monitoring Board. So, ayan. And then, we proceed to Section 5, Coordinating and Monitoring Body at the regional level. So, there shall be established in all regions a regional coordinating and monitoring board which similar membership and function as the national board. So sabi dito, dapat meron tayo regional coordinating monitoring board sa lahat ng regions. So ayun, dapat meron siyang similar membership and same function as the national board. And of course, for the last one, secretariat. So the Department of Social Welfare and Development shall serve as a secretariat to the board at the national and at the regional level. So, pagka sinabi natin secretariat, sila yung mga nagka-handle ng administrative aspect of the board. So, sila yung nagpe-prepare ng agenda and other related documents for the board meetings. And of course, sila yung nakikipag-communicate sa mga board's decision, communicate sa mga and then, sila yung nagpa-follow up ng updates on the agreement of the board. And of course, sila yung nag-update ng content sa webpage.
Final provisions. Article 26. Appropriations. The appropriation necessary to implement the provisions of the Act and its rules shall be included in the respective budgets of the responsible national government agencies subject to availability of the funds. The heads of the departments and agencies as well as local chief executives concerned shall immediately include in their annual appropriations the funding necessary to implement these programs and services. Section 1. The funds to be used for the National Health Program and for the vaccination of indigent senior citizens in the first year of implementation shall be added to the regular appropriations of the DOH and thereafter as a line item under the DOH budget in the subsequent General Appropriations Act or GAA, subject to availability of the funds. So, Section 1, yung budget na gagamitin para sa National Health Program at sa pag-vaccinate ng mga senior citizen na walang kakayahan ay idadagdag o manggagaling sa DOH. Section 2. The monthly social pension for indigent senior citizens in the first year of implementation shall be added to the regular appropriations of the DSWD and thereafter as a line item under the DSWD budget in the subsequent GAA subject to availability of funds. Section 2, senior citizens or mga edad 60 pataas ay may mga monthly pension na makukuha na magmumula or manggagaling sa budget ng DSWD. Section 3. The local government units concerned shall provide the necessary appropriations for the operation and maintenance of the OSCA. Article 27. Repealing Clause. All law, executive orders, rules and regulations, or any part hereof inconsistent herewith are deemed repealed or modified accordingly. Lahat ng batas or rules or executive orders na hindi naman related ay pwedeng mapawalang bisa or kaya naman ay baguhin. Article 28, Separability Clause. If any part or provision of this Act shall be declared unconstitutional and invalid, such provision shall be served from the remainder of these rules and such action shall not affect the enforceability of the remaining provisions of these rules. And lastly, Article 29, Effectivity. This Act shall take effect 15 days its complete publication in the Official Gazette or in at least 2 newspapers of general circulation, whichever comes earlier.